another area in your ideal clinic. You need, are you ready for this? You need an alternative, what should we call them? Alternative person? No, you can't call them alternative person. Obviously, this is somebody who knows how to lead a yoga program for people with PPS. This is somebody who knows how to introduce meditation and who's willing to help people through the difficult stages in the beginning and then get them over the hump when they relapse and say, I can't do it anymore. I see clinics as a way of promulgating information. That's very important. And promulgating accurate information, that's exceedingly important. So the whole idea about pacing, interestingly enough, is right on. It's absolutely correct. It's not only has it been shown many times by many people to be very effective, but there's good evidence why it works. For instance, when you overstress a muscle, you cause inflammation. So, of course, there's a problem there. So don't overstress the muscle. In other words, pace. Know your limits, learn your limits, figure out where they are. That said, know your limits, learn where they are, and then try to push them a tiny little bit. That's my personal opinion. A tiny little bit. And then back off. Because you'll find out whether you can or you can't. If you have an adverse reaction, if you have fatigue, if you have extra pain, back off. Don't do it. But sometimes you're surprised, and you can actually push that boundary a little bit further, and then leave it there for a while, and then push it again, because you can at the same time strengthen muscles. Especially once you reduce inflammation, your muscles regain some capabilities that they had previously lost, simply because the innervation is there for a longer period of time. So you shouldn't always accept the fact that you're going to get weaker and weaker. That's not the case. At worst, you may stabilize. Quite often, you actually can get some new strength back with careful and appropriate exercise. So there is the clinic's job too. What is careful? What is appropriate exercise for each individual? Because not everybody can figure that out, and you can always use advice. So again, that's the role of the clinic.
With my time at the clinic, we did a pilot study looking at yoga and post-polio. It was actually a combination of yoga and a chronic disease self-management course, which helped people to look at setting appropriate goals, managing their health care, and that was developed through Stanford University and is essentially applicable to anybody with chronic disease. The yoga portion of things was, again, I started out as a skeptic. I knew very little about yoga, and what I did know, I didn't see how these folks in wheelchairs or who were getting around with crutches and braces were going to be able to do yoga. Well, I was amazed, and we had a retreat where individuals went through the course and also were taught basic yoga, which was individualized to their needs. And yoga, as I'm sure you know, is a very key part of that. Is looking at is looking at relaxation, breathing, and things like that. And these are new skills to some of these individuals, but in that setting, especially, it was a phenomenal event because you had these individuals who were living with their polio and post-polio issues in isolation, and they all come together. And in that setting, it was kind of okay to look at some of these things. I dare say that any one of those individuals, had we seen them in the clinic alone and suggested yoga, it might not have kind of flown quite as much as it did in a group setting. And they took it very seriously. And again, I'm not very good at recalling the numbers, but I'm sure they'll share the study results with you. But it was phenomenal. 6 months later, we had the majority of patients were still doing the yoga. This is 6 months after the study ended. And you don't see that kind of compliance out of healthy individuals with a basic exercise program. So, and there were a number, just anecdotally, there were a number of people who would come back a year later and talk about that as being a pivotal turning point in their life. And they pointed specifically to the relaxation as being the key for them. And so that goes very much hand in hand with the sleep issues. I thank you for the segue there, because it is so important to be able to balance out that drive with the ability to have relaxation. And in no way am I saying that I think people are overdriven or they shouldn't be who they are, but it's important to have that balance. But as a general principle in this population, I don't doubt at all that relaxation therapy, eliminating stress, improving sleep, can have a profound physiologic effect, which would be more of a direct effect as well as the indirect effect. And what's contributing to what, I don't think anybody will ever know. But when somebody is able to deal with stress better, for example, when we look just at sleep, individuals who go to sleep with stress on their mind will have a different EEG overnight. They'll have a different sleep architecture. They won't get down in a deep sleep as much as somebody who's relaxed.